So today I want to discuss some medical news with you people. So here is the medical news today about the antidepressants, how the antidepressants increase the cardiac death risks. So let's discuss this article with you guys. So in this article, basically, there is written that using antidepressant can cause sudden cardiac death. So how it causes? So basically, it causes the QT prolongation. So in this article, that the antidepressant medication causes the QT prolongation when the heart muscles takes a longer time to contract and relax, may increase the risk of adverse arrhythmias events and in rare cases the sudden cardiac death. So basically, is written by this research was done by Jasmin Mujkanovic. What other things Jasmine has been noted? So he is the first author of new study recently presented in the EHRA 2025, the Scientific Congress of European Society of Cardiology, which confirms the antidepressant use may increase the risk of sudden cardiac deaths and differs between the age groups and years of medication. So he has researched on different groups of people uh, in which the antidepressant medications were used. So here is number one point that 1 year depression, when for 1 year the antidepressants are used, so it causes the 56% increase in the sudden cardiac death. So he analyzed the information and death certificates for the Denmark. He analyzed the medical information and death certificates for the Denmark adult residents between the ages of 18 to 90. In 2010, researcher categorizes the participants and they had experienced the sudden cardiac death and by their antidepressant medications between 1 to 5 years or 6 years and longer. So after the conclusion, he found that participants who used the antidepressants for longer period or for period of 1 to 5 years has increased 56% increased risk of sudden cardiac death, which is more than the other people and participants who were using antidepressants for 6 or more years. So they have 2.2 times higher risk of sudden cardiac deaths, even they have more. So what other point is written in this? So here it is the high sudden cardiac death incidence rates for those taking the antidepressant for 6 plus years. So for participants between the ages of 30 to 40 years who used 1 to 5 years, they were 3 times more likely experience the sudden cardiac deaths. And those who did not take the medications, to those who did not take the medications, they increased the risk 5 times even who used antidepressant for the 6 years or more. And in 50 to 60 age group, 1 to 5 years antidepressants doubled the sudden cardiac death effect or risk and quadrupled for those who has used for 6 or more years the antidepressant tablets. And for looking 40 to 80 years age, he found that sudden SCD increased incidence ratio significantly higher for those who use the antidepressants for 6 years or more as compared to 1 to 5 years. Within each group, those exposed to antidepressant had higher risk of uh, sudden cardiac death compared to their unexposed peers. The Jasmine Mujkanovic explained. And this is also the research he explained. Then there is some reassurance. The main takeaway from this study, please do not panic if you are on the antidepressant, although the study shows the risk is increased among the exposed. Depression itself is independent risk factor for the cardiovascular disease. So cardiovascular disease, when you are in depression, so there is higher chances for the cardiovascular diseases and sudden cardiac death, but the increased risk is most likely multifactorial and highlights the needs for more holistic approach to manage the mental health as well as the cardiac health in these patients. What other in this article has been written? Why might antidepressants use contribute to the heart problems? So had the opportunity to speak the Chen Yang MD, a board certified interventional cardiologist. Um, and he said that it may be that antidepressant increase the arrhythmias in patients, leading to an increased risk of SCD. Arrhythmias occurs due to prolonged QT interval. He hypothesized, however, it is possible that underlying depression itself led to increased SCD, and also the depression also increases sudden cardiac death through increasing the cardiovascular risk factor. Patient taking the antidepressant medication should talk to their physician before making any changes in the medications. There is close relationship between depression and other areas of personal health. Antidepressants can increase someone's risk of developing the heart diseases, and may people with the heart experiences the depression. They Chen further explained that antidepressants medications can thus play an important role in improving many aspects of individual health. Future research is needed to determine the mechanisms by which the antidepressants might increase someone risk for the SCD, sudden cardiac death. Should you worry about the antidepressant use? So the chief, the Grant R. Simons speak that about this research that Simons commented that finding seems alarming. At first glance, it is crucial to consider the limitations of observational studies and avoid jumping to conclusion about the casualty. Further research is needed between the complex relationship between the psychiatric disorder, antidepressant use, and sudden cardiac death. The continued patient should discuss any concerns about the medications with their doctors and not discontinue the treatment abruptly. While 56% increased risk and double risk with the longer term use sounds dramatic, it's important to interpret these findings cautiously and within the border. It is possible other factors related to having the psychiatric disorders and taking anti such as the lifestyle medications underlying itself to increase the risk of sudden cardiac death. He continued, for example, it is important to recognize that use of antidepressant for the long period of time may be a marker for other risk factors or sudden death. The study may have controlled some of these, but it's difficult to account for everything. It's important to see the study align. So this was basically an article that I have discussed with you. It is basically a medical news that I wanted to share on my YouTube channel for you guys, that antidepressants can also increase the sudden cardiac death risk. So please use cautiously the antidepressants. Thank you.